Hello everyone. So welcome to our next episode of Decoding the Most Prevalent Skin Concern, which affects not only the teenagers but it affects the entire age group of people, that is acne. So I am Nima, co-founder at Skin Clinic. Hi, this side Dr. Ashima. I'm a board certified dermatologist. So we will be taking you through all the aspects of acne concern, right from what exactly it is and what are the treatment options available. So let's start, doctor. Let's start with the basics. So what exactly is acne and why do some people, struggle more comparing to the others? So acne is basically a disorder of the hair follicles and the oil glands. Okay. So the oil glands and the hair follicles, they get accumulated with the dead cell particles and the excess of oil production, leading to bacterial overgrowth, leading to more inflammation, and yes, then the breakouts. Okay, and is it true that it is just not the problem of teenagers? Yeah, definitely. See, it's very common in puberty because there is a role of hormones, definitely. But presently, I'm seeing there is a rise of cases in 30s, 40s, even 50s, which we usually call as adult onset acne. Yeah, we do get clients, who are having the lot of acne in their lower face. Yeah. So, what exactly, are the triggers that people should consider? Okay, yes. So, hormones they play a very important role in occurrence of acne. You can see that there is a rise of acne during the menstrual phase. So, menstrual cycle basically. So, leading to like and implies that it is affecting more towards the hormonal issues. Then, secondly, stress. Stress can also trigger your cortisol levels, which can lead to more acne. And definitely, then diet also plays an important role. If you're consuming food with high glycemic index, dairy products, then it can lead to more acne. And also your genetics, yeah. So if your parents have had more acne in their childhood, then you also have a tendency to develop more acne. Great, doctor. So, definitely, food plays a very important role when it comes to skin health. Okay, now let's break down to what are the different types of acne. I mean, हमारे पास ऐसे clients आते हैं जिनको कुछ लोगों को जो है they're having this comedonal acne, कुछ लोगों को कुछ pseudo acne वगैरह होते हैं. How these are like differentiated? Okay. So there are basically two types of acne. It could be a non-inflammatory or an inflammatory acne. So now the non-inflammatory acne they include the blackheads, the whiteheads, mainly the comedones, which are resulting from clogged pores. Okay. So your inflammatory acne includes like papules, which are just the red bumps which you see on the skin. Okay, it could include a pustule, which is a pus-filled acne actually. Okay, it could be a nodule. Nodule is more like a swelling, which is like painful and deep inside your skin. And even a more deeper swelling is a cyst. So now the deeper the acne, there is more chance of developing of acne scars. Right. So I was coming to that, doctor, because people get acne, and if it is not controlled, then there are two things that generally stays over the skin. That is either the marks, yeah, which are popularly called as acne marks, and the capillary scars also. Yes. जो जिसकी वजह से लोग बहुत ज़्यादा परेशान होते हैं. Yes. So let's talk on what is the difference between acne marks and acne scars, so that people are able to differentiate between these two. Okay. See, the acne marks are mainly the post-inflammatory hyperpigmentation or the PIH, which we call it as, which is left behind once your pimple heals. So it could be black, or it could be brown, or it could be purplish appearance, depending upon your skin tone, like what is your skin tone. Okay, and it's mainly a temporary feature. So even if you don't treat it, it can go away, but it might take months to go away. But it's not a permanent scar. And coming on to the acne scars. The acne scars are mainly the textural changes which occur once your acne resolves. So that's very well differentiated, doctor. At the same time, acne scars एक ऐसा concern है जो कि बहुत लोगों को बहुत परेशान करता है, and once they are developed and treatments के लिए people see a lot of options. Now, is there different types of scars? Yeah, definitely. The acne scars are also like they could be atrophic scars or they could be hypertrophic scars. So atrophic scars include ice pick scars, rolling scars, box scars, okay, which are mainly leading to depressed scars. And they could be hypertrophic scars, including keloids. So then there is basically excess of collagen production in that. So to summarize, what I understood from what you just shared is marks are the discoloration that fades with time, but acne scars are the textural changes that happens post acne. Oh, yeah. Okay. So again, I'm assuming that prevention is the key for both. Definitely. See, if you are popping your pimples or you're fitting your pimples, then there are more chances of developing scars. Okay. And obviously, more early you consulting a doctor, you're getting your treatment done, so earlier will be the resolution. Yeah. So now let's get into what everyone wants to know is the treatments. So what should someone do for the active acne? So there could be over-the-counter options which are available. Like there could be topical salicylic acid, which can unclog your pores. There could be topical retinoids, which can increase your cell turnover, and that it can lead to reduction in inflammation. See, for mild acne, you can go for the over-the-counter medications. You can look for ingredients like benzoyl peroxide, okay, which can kill the bacteria causing acne. You can look for salicylic acid-based products, which is that can unclog your pores. And even topical retinoids, for that matter, they can increase the cell turnover, they can reduce the inflammation. So yeah. Okay. And when should one see a dermatologist? When your acne are painful, there are hard lumps, and you are getting scarring, then that is an ideal time to consult a doctor. Okay. And doctor, what are the prescription options which are available? There are several options. For mild acne, you can look for the topical options like topical benzoyl peroxide, topical antibiotics basically. So they can help in killing the bacteria and unclogging the pores also. So we can look for options like topical retinoids, like tretinoin, adapalene, which are basically the gold standard of treatment. Okay, and in case you have severe or inflammatory acne, we can also give isotretinoin, also known as Accutane, which is it's a miraculous drug, I would say. And in case you're having hormonal acne, then yes, you should consult a gynec alongside, and there should be hormonal therapies like spironolactone, and then your birth control pills. They're also effective. But I've heard that isoflavones, they are very harmful and they have very side effects. Okay. Yeah, definitely acetylcholine it has side effects, but if it is given under proper guidance, under proper safer dosage, consulting a dermatologist alongside, then definitely the drug can give excellent results. Perfect. So, I'm assuming that definitely, isoflurane kind of a medication that they should be used only after correct prescription from the dermatologist. Yes, definitely. Now coming to that, what are the treatment options available, and is there something new which is exciting for the treatment of acne, scars, or marks? Yeah, so there are other treatment options like chemical peels, okay, including salicylic peel, and there are options like laser therapies and LED therapy, blue light therapy, so which can reduce your oil production. Until now, this was about acne treatment, but then yes, more problematic are the acne marks and acne scars. So what are the treatment options for that? Okay, so for acne marks, which I already told you, the pigmentation, the post-inflammatory hyperpigmentation, there are options like hydroquinone, alpha-arbutin, niacinamide, kojic acid, which can inhibit the melanin production. Okay, and then there's retinoids also, topical retinoids, which can increase the cell turnover. So these options they can work effectively for pigmentation. And the in-clinic procedure like chemical peels can also work wonders, like salicylic peel and glycolic peel. Okay. So, like whenever client comes to us, they are they generally ask this question that मुझे एक session में result आ जाएगा या how many session it's gonna take. So how long until people can see the result? See, usually, for noticeable improvement, ideally 4 to 8 weeks is required. But for effective result, it might take months. Okay. So for acne scars, the textural changes are there. So what can be done to get rid of those? Okay. So for the atrophic scars, there are options like microneedling with or without radio frequency. There's laser therapy available, which could be ablative laser, non-ablative laser. Then there could be a chemical peels, including TCA cross for ice pick scars, which we can do.
And for hypertrophic scars, we can obviously there are interlesional steroid injections which can be given. So there are various treatment options, and combination of everything works best. So usually, depending upon the patient and their types of acne, the severity, we usually give a proper treatment plan, which is basically individual.
Okay, so let's talk about the skincare routine. So if someone is having an acne-prone skin, what he or she should be doing every day?
Okay, so the key is to keep it very simple, keep it basic. You should cleanse with a non-comedogenic gentle cleanser twice a day, and then you should use your over-the-counter medication, whichever you're using for acne, be it benzoyl peroxide or topical retinol. And it's important to moisturize also. Even if you're having oily acne-prone skin, moisturization is also important, because if you won't moisturize and the skin will become dry, it will lead to more oil production. And definitely sunscreen is also important, because if you're treating acne scars and you're not applying sunscreen, then you can lead to more pigmentation.
Perfect, doctor. That you made it, very simple, but at the same time, I see 15, 16-year-old girl coming up with 7, 8 step skincare routine and still complaining of, that, acne are not subsiding. So what are the common mistakes that, generally people do?
So see, firstly, over exfoliating is a mistake. Okay, applying too much of scrubs, exfoliating, leading to more irritation and more acne and breakouts. So you should avoid that. Secondly, don't introduce multiple products all at once in your skincare. It should always be basic and simple. So you should always introduce one product at a time. When you have acne, don't pop your pimples or don't pick your pimples, and moisturization and sunscreen is important even if you're having acne, because skipping them can lead to more damage to them.
Right. So, in the beginning, we discussed that acne is also a lifestyle, a concern.
Yes.
So, any lifestyle change you can recommend that can help our audience?
Yeah, so see, as I already told you, acne is mainly it could be diet related. It's always better to consume low glycemic index food and as avoid dairy products as much as possible, because that can lead to more acne.
Okay, doctor, that has been incredibly informative. So before we wrap up, I would want one message. What our viewers can take as a takeaway from this conversation on acne.
So acne is a medical condition. It's not a reflection of your poor hygiene or your personal failure. So, and it is treatable. Be it acne, active acne scars, acne marks, everything is treatable. So it's better to consult a medical health, consult a dermatologist, and get yourself treated effectively and timely.
Beautifully said. And I want to tell all the viewers here that acne treatment of the acne takes time. The result shows up, but what is required in the treatment journey is the patience, because your consistency and proper skincare that plays a very important role when it comes to the treatment of acne.
Yeah, consistency is the key for treatment.
Yeah. Thank you so much, doctor, for joining us.
Thanks for having me here.
So thank you everyone for watching this video. We hope that it was helpful, and if that is the case, then give us a thumbs up and subscribe our channel. And if you have any sort of query, then drop it in the comments below, and take care of yourself.